Welcome back to the Tier 1 Health and Wellness Podcast. I'm Angie Nichols, and I'm here with my husband, Dr. Keith Nichols. We are so excited for today's episode because we have a true rock star in the field of environmental health joining us, a woman whose voice has helped shape national policy, advance public health research, and inspire generations of scientists and clinicians. Today's guest is Dr. Linda Birnbaum, a world-renowned toxicologist and microbiologist who served as the director of the National Institute of Environmental Health Sciences and the National Toxicology Program. Over her 40-year career, she has published over 700 peer-reviewed articles, mentored countless young scientists, and testified before Congress on issues ranging from chemical safety to children's health. Today, we will dive into the truth about PFAS exposure, why it is showing up in everything from cookware to drinking water, and what primary care providers need to know, and how we can protect ourselves and future generations. So grab your coffee and your cleanest glass of water and get ready for a fascinating and important conversation. Welcome back, Dr. Birnbaum.
Happy to be here.
So you have spent decades studying environmental toxicology and public health. One of the most urgent topics today is PFAS, the so-called forever chemicals. Many people have heard the term but may not know what this means. For those who are new to this issue, what exactly are PFAS and why are they referred to as forever chemicals?
PFAS, the technical term is per and polyfluoroalkyl substances, which is really a horrible descriptor. But PFAS involve over 15,000 different compounds that every single one has multiple fluorines atoms attached to carbon atoms. And the carbon-fluorine bond does not occur in nature. Although fluorine is a very common element in the world, that bond does not occur. And when it is made synthetically, it is one of the most difficult bonds to break. There's no easy way to do it. And that's why they're called forever chemicals, because nature, since nature never knew that this bond existed, never figured out how do I break it down. And therefore, whatever PFAS are made are going to be with us not only for our lifetime, but for as far as we can see in the future.
PFAS are used in everything from the nonstick cookware to firefighting foam, flame retardants, but the public is just now catching on to this risk. Can you walk us through how PFAS became so widespread in consumer and industrial products, and how have they ended up in our water, our soil, and our blood even?
PFAS were first synthetically made, I believe, in the 1940s. Maybe the first synthesis of one specific PFAS was in the 1930s. And their use really began to grow exponentially in the 1950s and 60s. And the reason for that is they're very useful chemicals. They are used as stain repellents. They are used as surfactants. They're used in electronic equipment. As you mentioned, they are used in air film forming foam, which is a kind of foam that's used to help put out fires, and they're very effective at that. There are over 200 different kinds of uses that PFAS can be put to. In the PFAS are also the small PFAS, put it that way, the smaller ones are often used to make polymers. And when you make polymers, polymers also have extremely long lifetimes. Many of them we don't know. They're close to forever chemicals. But the point is you got to make them with PFAS. And when some of them do eventually break down, then they generate PFAS. So your polymers containing that carbon-fluorine bond are PFAS as well.
That's great. So the other part of the question was, so how have they come to end up in the water and the soil and
So
even
they're used in so many different things. So we know that water, if you're near a place where PFAS were made, and there are a number of places in the country, especially Minneapolis, St. Paul, Minnesota, the area near Petersburg, West Virginia, right on the Ohio River, the area on near Fayetteville, North Carolina, and then there were some others There's a place in New Jersey. Anyway, if you happen to be, let's say, largely downstream from where those plants were, until 10 years ago, in many cases, the PFAS were just dumped into the river from the plant. If not, there was certain leakage. We know that if you live near a place where the PFAS were used industrially, so for example, in northern Alabama, where PFAS were used to make stain-resistant carpets, we know that there's elevated levels there. So we actually have some predictions of where levels in the water will be higher. We know today, and I don't think we really knew this. I know we didn't know this even 10 years ago, how contaminated wastewater can be from a municipal sewage plant. And if that wastewater is spread on your garden or on the fields, you contaminate not only the vegetation that grows there and if any animals graze there, but also what happens with topsoil, well, soil. I mean, and it washes off and gets into the water. So in some ways, water is kind of the final resting place for these PFAS. And because PFAS are, many of them are very water soluble, they'll stay in the water. They'll move downstream. Some of them will stick to sediment. So we know that it can be found in the sediment in the soil as well. And I should mention that PFAS, like many kinds of chemicals, while they're not very volatile, some of the PFAS, some of these 15,000 are very volatile. And for example, coming out at high temperature from a plant where they're being made or used may lead to air deposition in the surrounding area in Fayetteville, North Carolina, near the Chemours plant, which used to be a DuPont plant. They've detected PFAS in the air 25 miles away. And then we know that these kind of chemicals undergo something called vacuum distillation. But what that means is that warmer climates, a little bit of this will be bound to particles, will actually go into the air, will be carried by the upper atmosphere and travel where the winds go, which take it up to the Arctic. So the Arctic is now highly contaminated. PFAS were never used in the middle of the Arctic, and yet it's contaminated because goes up with the air or moves with the ocean currents. And when it gets cold, falls out and ends up on the ice and snow.
I found that very interesting. One of the most uninhabited places on the planet, one of the most toxic because of that. It's just amazing.
Correct. And it's even been found in Antarctica as well, for example.
Right.
And things tend to move, well, because there's so much more industry in the northern hemisphere than the southern hemisphere, the contamination tends to be higher. But we do find these chemicals all the way in the Antarctic as well as the Arctic.
So there's growing concern about the long-term health consequences of PFAS exposure. Some of the recent studies are alarming. What are the most well-established health effects linked to PFAS, which are still under investigation?
Well, let me just say, I'm not sure there is any system in our body which cannot be impacted by PFAS. And the reason is, I have to back up a second and say that, I spent much of my career studying TCDD and other related dioxins, things that were present like in Agent Orange, and are often called the most toxic man-made chemicals. But in order to have an adverse effect, dioxin has to bind to one specific kind of receptor in the cells. PFAS bind to at least 10 different receptors in the cell. So maybe they don't have an effect in one tissue by one mechanism, but guess what? Then they go to another tissue where there's another way that they can have an effect. And I think that's something to remember. So there's tremendous amount of study going on. Now, we know a lot about a very small number of these 15,000 chemicals. But and those especially are PFOA, which is sometimes called C8, and that was the major contaminant in West Virginia and Ohio from the DuPont plant there. And then there's something called PFOS, And PFOS is also a C8, but has a different group at the end of the carbon chain. And that was a major contaminant in the AFFF, which again, so tremendous levels of contamination around most military bases, around many airports, and so on. And there are probably another 10 PFAS that, or maybe more than that, maybe 20 or 30, that we have some data on. And I should say that, for example, something like C9 PFNA, which is very closely related to the C8 PFOA, basically does many of the same things. And for example, PFHXS, which is the C6 relative of PFOS, does many of the same things. And all of them do multiple things. So it's kind of, as we study more, we start seeing more and more effects. And as we ask different questions. So I actually was studying the C10 called PFDA, closely related to PFOA, in the 1980s. But the kinds of questions I was asking then were much less sophisticated, less, in some ways, informative. I mean, I was able to show that this affected the liver and that it caused endocrine disruption, especially with the thyroid gland. But I didn't look much beyond that. Today, we know we have to look for other things. So when you ask, what do we know at least some PFAS are associated with? Cancer. The data for the association between PFOA and growing data for PFOS and kidney cancer especially is quite strong, really very strong. There's also data showing an increase in testicular cancer, which is a cancer, not most cancers, are in older people, the great majority, but testicular cancer is in younger men. In other words, by about 50, men don't get testicular cancer anymore. And testicular cancer, thank goodness, is a kind that if it's detected early is usually by surgical removal of that testis, people can usually survive from it. But anyhow, so those are, I think that data is clear. Other data that's very clear, I believe, are impacts on levels of cholesterol in people. Now, there are some in industry who tell you, well, that does, look, we don't see that in our animals. Well, if you put our rats or mice on a diet like most Americans eat, which is a pretty high-fat diet, instead of a typical experimental animal diet, which is very, very low in fat, they get the high cholesterol just like people do. And it's especially the LDL, the low density cholesterol, that we're most concerned about. And there's starting to be evidence that there may be an increase in liver cancer as well. There are some studies showing there may be an increase in breast cancer. Again, the data is still evolving, and these are very difficult human studies to do. I should say, the PFAS that have been tested, and not many have been tested, but do show cancer at multiple sites in our rats and mice. Okay. And in general, we know if something does cause cancer in our experimental animal models, it has the potential to cause cancer in at least some people. Now, I think the effect that actually was the basis for some of the regulations of some of the PFAS has been the suppression of the immune system. And initially, that was first reported only, the first report of suppression of vaccine take rate. In other words, what was the antibody level that you would get if you were vaccinated and it was done with both tetanus and diphtheria. And that first study didn't come out until 2012. Since then, it has been repeated in multiple populations by different investigators. And then within the past couple of years, there are many studies showing an association with infectious disease. So children having higher rates, for example, of ear infections and other kinds of hospitalizations related to the exposure to PFAS. Now, I should back up and tell you that, again, in our animal models, we see this. We saw back in about 2007, people actually in my, who were working in my division showed that there was a suppression of the ability to mount a normal antibody response to PFOA. And that's been shown in multiple studies now. So again, our animals are, in general, fairly good predictors. So I think the impacts on the immune system. And what's interesting is we're also seeing reports of an increase in autoimmunity. And we know that in our general population, autoimmunity is decreasing. There's type 1 diabetes is an autoimmune disease that's increasing, and many other kinds. But ulcerative colitis has been shown statistically to be associated. Some of the other things, and I'm probably, there are more I'm not going to forget, but I should have said both with the liver and the cholesterol, there are associations with obesity and type 2 diabetes that are being reported, increased risk. There's also preterm birth and low birth weight babies. And this is extremely concerning. The incidence of preterm birth has gone up, and babies that are born early and babies that are small for their gestational age, we know that those babies are at increased risk later on for a variety of health impacts. The effect I haven't mentioned, because I think the data is still evolving, is effects on learning and memory. And there are several studies that show impacts on IQ from early life exposure. Those data are still not consistent, but I think as more studies are conducted, I think we will see more effects being reported. So that just gives you a few to think about. Oh, I mentioned kidney cancer. I didn't mention kidney disease. And I think you may be aware of the fact that chronic kidney disease is increasing in the population as well.
So to kind of reiterate what you said, we barely scratched the surface on our knowledge of these chemicals, correct? I mean, there's so much that we don't know, much more than we don't know than we know.
That's correct. But from a public health point of view, I think we know enough to know that we have a problem.
Absolutely. Absolutely.
And that it's time that we, the colloquial would be turn the tap off. But, it's not just the water issue, because we know that, yes, PFAS can be in the water, but for most of us, our major exposure is from what we eat, because PFAS are used extensively in plastics. So a lot of food containers have PFAS, and the PFAS are just kind of mixed in with the plastic. They're not chemically part of the plastic. So I've been warning people for 30 years not to microwave in plastic. And originally that was because I was thinking about the dioxin that might be there. But we know now that there are many other chemicals that are just mixed in to make the plastic, to make it more supple, sometimes to make it firmer. And at the warmer the temperature, the more those chemicals will move. So we know that food is a major source. We know that, for example, people who eat more fast food tend to have higher PFAS. We know, unfortunately, that essentially all of our freshwater fish in this country are contaminated with PFAS, especially PFOS. That's about 75%. But there were 500, every, I forget if it's 5 years or something, EPA has sampled fish and made composite samples of different kinds of fish from 500 different freshwater regions in the US. And when they were looked at for PFAS from the samples taken, I think it was about 2013 to 2015 approximately, the paper was published with the analysis in 2023. They showed that of the 500 samples, all but 1 or 2 had elevated PFAS. And if people ate a lot of those fish, and some of our indigenous communities or some of our immigrant communities who eat a lot of fish, those people, 4 meals a year would be enough to raise their PFAS to a level of concern. So anyway, so freshwater fish have PFAS in them. If you're living near one of those places where the PFAS were made or used in some of those areas, for example, your deer may be contaminated.
Well, I was interested to hear that you mentioned younger individuals, testicular cancers, thyroid disorder. So we know it affects our endocrine system as well. Now, from a
Correct.
clinical standpoint, this is where it gets a little tough for us because PFAS toxicity is not associated with any characteristic signs or symptoms, correct?
It is. We're not concerned really with a very high level acute exposure. That's not what's happening.
Right.
We knew that from the cattle in the West Virginia situation, they literally became loco and died. But they had really, really high. That's not, we're concerned with low level ongoing exposure.
Right. Now that was the movie Blackwater, I believe, correct? Blackwater
Um,
We know.
or the devil.
well, there were two. There was like a short, and then there was Dark Waters
Dark
Dark
Waters,
Waters,
yes.
thank you.
with Mark Ruffalo, right? The story of Rob Billett, who is the defense attorney who basically went on the offense and is still doing some great work.
Great.
Well, from a clinical standpoint, kind of the what I was trying to get to as far as younger individuals and endocrine disorders is we have these individuals come in, as you know, we focus on hormone optimization for men and women and other health issues, but they typically want to know why. Why am I at this age? Am I having a thyroid disorder? Why am I having low testosterone? Why am I having these issues? They literally always want to know why, and we can't give them an answer why. I do believe it is, and I tell them all the time. I believe it's our toxic environment. I believe that's why we're seeing this in younger individuals that we didn't see in older individuals, and I think that's the big issue from a clinical standpoint. But what really kind of concerns me is that none of our guidelines, as far as treating any of the disorders, factor these toxic chemicals into the equation of their workup and treatment. And so a lot of them are denied treatment, despite having significant symptoms of a hormonal abnormality, such as deficiency. And that's just the way our guidelines are set up. But there's no mention of, PFAS or endocrine disrupting chemicals as far as the treatment, even though the Endocrine Society has a complete section on EDCs, it still doesn't factor into any of their guidelines under the treatment of any of these disorders. And I think what's also important is that, of course, we want to limit the exposure because when we do get the exposure, to my knowledge, there's no medical treatments that are available to remove PFAS from the body. None at all.
Well, let's back up there. There was one paper published about 10 years ago with 3 subjects, which showed that cholestyramine, which is used basically to interrupt what we call the cycling that goes on. And so to facilitate some of the PFAS coming out in the poop. And it showed that I can't remember if it was PFOA or PFOS, one of them, that it did seem to have an effect. There's a paper recently that came out suggesting that, another chemical like cholestyramine. Cholestyramine has been used successfully for years to reduce cholesterol levels in people with very high cholesterol. It's something people don't like. It's not a pleasant drug, but could be clinically approved. So people are trying to look for ways to reduce our PFAS. But if we reduce our PFAS, where's it going to go? It's going to go to the sewage. Then it's going to go to the sewage treatment plant. Then it's going to go on our gardens, and we can be re-exposed again. So, I mean, this is part of the issue. But I think it's important to realize that PFAS not only impact the thyroid system, they also impact the estrogenic and the androgen system, and they dramatically impact our systems involved in drugs that, for example, we use to treat diabetes or things that cause a diabetic response. So they do a lot with endocrine. I think the Endocrine Society, compared to many of the major medical societies, is light years ahead of many of them as far as recognizing the importance of environmental chemicals in our health. But you're right, they have not really focused on PFAS yet, and it may be something I need to spend some more time talking to some of my buddies there about.
Well, I think point would be to consider, to have that as a consideration for when these individuals come in, because we have to treat them. They do, our patients do have real issues and real problems that, they're a lot of times just kind of pushed off to the side for.
So there are some guidelines. The National Academies did publish a consensus report in 2022 where they looked at the association between a total of 16 PFAS in blood and a variety of health effects. And they came out with some guidelines related to the levels of 7 of those PFAS, because those were the ones that basically everybody had in your blood. If your levels exceeded what was called 2 parts per billion, which is a very small amount, but if your levels exceeded that, then there were certain things that you should look for. If your levels exceeded 20 parts per billion, then you really needed medical monitoring and to be followed for a number of health effects, including the elevated cholesterol, including impacts on your thyroid, including impacts on the immune system. Those guidelines are published. They were published by CDC a little over a year ago, and are available. And I've been told, I don't know whether it's true, that if somebody is concerned and has about what their levels will be, then insurance should pay for that. And then they could be, they could be tested and find out if their levels. Do I think, something that is published in 2022, most of the work for it was finished in 2021. Well, with the pace of research on this class of chemicals has exploded, and there might be some other health effects, and there might be some other levels that would be people, the levels might drop.
I was very happy to see that they had issued those guidelines for primary care providers to start looking at it, at least raise awareness. But like Keith and I talked about, for a primary care provider to have the time to get into that area, I mean, I think in a regular insurance practice, you might have, 6 minutes,
6 to 10 minutes
to spend with your patient, and
is.
you're looking at all the acute problems. And this is like way down the list for most providers, if they're even aware of it. But I thought it was a very positive thing that they're actually putting information out there to try to make the primary care providers aware. But more importantly, we tell patients this all the time: you have to be your own best advocate. And so I think it's so important for patients to know this information and bring it up to their primary care providers. Or I looked up, we can order a PFAS test through LabCorp, and it's around about, I think, $200 for that test if you pay cash, service. But from what I was,
which Angie, is too much money.
yeah,
it's too much. But frankly, if I were living in Fayetteville, North Carolina, near the Chemours plant, I might want to have my blood tested, and I might prioritize doing that.
right.
If I have a real reason that I have excess concern. I'm often asked, what can people do?
That's right. That's my next question. You're high. What do we do next? What do we do next? And you're high. What do we do?